It's a great pleasure and honor to be here and be a part of this TEDx event. Today I am going to talk about something which is the journey of a hybrid person who started the academic journey with a lot of what I would say dream, but no direction. And to confess that this lack of direction took me to some direction, and I would like to share those so-called decisive moments which came almost like spontaneously rather than designed, and that is the sole aspect that I am going to talk about here. So if you see, it's why I called it hybrid is because it's an engineer's journey towards something which an engineer will not commonly look into. So when I was an engineering student and maybe an early career researcher, engineering was a perception, right? And that perception will include both hardware like machines and software because those tools are progressively more important as engineering as a discipline progresses. Now, where disease detection comes to the role of an engineer is something which was not clear to me at all, or even not known to me, to be frank, at that point of time. So what I will do is, I will try to go through very briefly with the decisive moments that came in the way. In my very early career research, I always wanted to do something which is interesting and which is engaging. And I think that is the motto that if anyone carries, that particular enthusiasm will carry you through. All of us have certain interests, and all of us have to do certain things out of compulsion. And usually there is a conflict between these two. People want to nowadays use mobile phones for their own pastime. They have to do something for their, what I would imagine, profession, and even education is a prelude to that. But when these two merge, possibly your passion becomes your profession. So when we started this journey, my entire motivation was really to get into the cutting edge, deep science and technology to solve certain problems in micro and nanofluidics. That means how fluid flows through small channels. There are beautiful facets of that. But at the end, as engineers, when we do something, it is not always like the glamour of a research that should be of focus. Now, the question is that as an engineering researcher or a professor, whatever, what can I do to dedicate to the service of the nation? And then came this realization, the turning realization number one, that within 1 kilometer of the great institute, you see darkness. And the darkness doesn't mean literal darkness, it means lack of access to the basic facilities which every human being should enjoy. So I thought that charity begins at home. So if I cannot make an attempt to solve problems of my own neighborhood, how can I solve a national and a global problem? Those are much bigger in scale. Now, one of the major problems is healthcare. Now, there are many areas, but I am getting into healthcare because that is the focus of what I am going to talk about for the rest 10 minutes or so. So what is always known and known to everybody, that in those remote locations, you do not have the resource clinics. You do not have the kinds of technicians, doctors who will build up a high-end system. You do not have the infrastructure. But that doesn't mean that the people there have the destiny of getting deprived. Now, fortunately, with the help of the government and many of the NGOs, you have digital health clinics established. And these digital health clinics have the foundation which are based on the digital technologies. Whatever it is, the data goes to the doctor, remote doctor, and the doctor in real time can interface with the patient and the frontline health worker. But what the doctor will do? Doctor is not a magician. So doctor with that minimal information will get into some essential medication and typically on the first visit, if necessary, some essential diagnostic tests. And that is where the real crisis starts. Because software is something which can bridge the gap. Communication is something which can bridge the gap. But for doing the diagnostic test, when you need a hardware, that's a big challenge. Now, what are the challenges in the hardware? So, first of all, we are not usually conscious about it, but all high-end research is usually done in the lab, and all high-end technical activities may not be research, just deployment also in the lab. A diagnostic lab, for example, will have a high quality power, will have environment control, will have refrigeration, etc. for storing sensitive items. There is a stable supply chain of important materials. You have quite well-trained technicians to perform the activities. In a green field, if you want to do the same test, you do not have that luxury. So you have uncontrolled dirt, dust, humidity, and you do not have the air conditioning mostly. If you have a freeze, you may have a central some storage which is minimal, and it is not that quality of refrigeration that one would have for storing sensitive items. Technicians, well, you have, but they are not nearly of the same level that you would have in a resourced place. And then if you have to develop a technology to beat all these, the technology may become very complex, and then it can become expensive, and that people will not be able to afford. So the solution, what we call as point-of-care system, and point-of-care, all of you are familiar, you may not have heard about this as a terminology, but like for example at the home you prick the finger and have a glucometer to do the sugar test, that's a point-of-care test. Even like a pulse oximeter is also a point-of-care device. So the whole idea is, instead of the patient being taken to a clinic, it's a smart device or a platform which is brought to the patient, and the patient can be tested. So what we did is, so this is one lesson that I have learned, that simplicity is something which can give you imaginative ideas. And when such an imaginative idea comes, it is much, much more impactful than maybe an idea that comes out of very complex thought process. But for every test, you cannot do it in such a simple way. There are many tests where you require to magnify what you see. So in the lab, you see a microscope. Now to have a microscope, you have to go to a resourced lab or a center. You cannot have a microscope on a green field normally, unless someone is having a special arrangement. So what we thought of is that you would make a small microscope by 3D printing with lenses organized and the LED light, etc., to create the impact of a magnification of around 1000. But with this microscope attachment, you can have at most maybe 1000 times magnification, not more than that. So here comes AI. So whatever is this low quality image, you can train your AI to interpret as if you are interpreting a high quality image in a lab based system. So the whole idea is that you have a simple technology, and the simple technology is trying to solve complex problems. Another example, when we had the COVID as a crisis, the challenge was not really the cost of an RT-PCR test. More so because typically in the second wave, what we found is that it is taking quite a lot of time to get the report, maybe 48 hours. Someone who is having an acute respiratory distress, those 48 hours can mean the difference between life and death. So what we try to do is to develop a technology for rapid COVID detection, which we call as COVIRAP. So you see the test running in the video. So you have just a small machine, and being a mechanical engineer, I enjoyed designing this machine because this is essentially a heat transfer machine. So in a PCR test, you have cyclic heating, and cooling. Now every act of innovation has something very positive, but it will have its own limitations. Now COVID is gone, but say now all the other major infectious diseases, many of the diseases, they keep on threatening people everywhere in the world. Children in school get commonly affected by seasonal flu. So now remember that COVID test, like poking your nose or mouth with that swab stick and getting the swab. The first time when I had my test done, before that I thought that it would be much sort of easier and convenient than a blood test, but then I realized that it cannot be more uncomfortable. Now you cannot do such a test on a daily basis to a kid. But what you can do is something, so forget about the swab. Use a saline gargle. So just gargle the saline and then put it in a container and do the same test in the machine. So there could be adaptations to make a complex instrument and its performance simplified and more simplified. And every thought process that brings you to that is a golden moment. And these things do not come out of design. These things come out almost like in science what we call as serendipity. I mean accident. Pencil, all this, just like school work education. So you put the cultured bacteria and you put antibiotic medicine and bring them together. If they react and the antibiotic is killing the bacteria, you have a third layer which has a blue colored chemical, it will convert into pink in 3-4 hours. What is the utility of this? Antibiotic resistance is a curse in the modern era. That means when you have the antibiotic medicine needed to save your life, that medicine is not working. So how will a doctor know that for a particular patient which antibiotic will work or not in advance? So this is a way in which maybe 3-4 hours with every droplet of different antibiotic medicines, the doctor can try out where the blue color is changing into pink. This is the urinary tract infection test with E. coli as the bacteria, and that is what it is. Now the motto has been so far what I talked about is simplification. This is against the natural scientific way of complexification, and our general perception is more complex means more glamorous. But one has to realize that simplification is the ultimate thing. So to come to a conclusion, it is not just a technology, but we have to imagine that it's an ecosystem. And as an academician or professor like me, it has always been a continued learning experience. So I started with zero knowledge, zero experience. Then I realized that we can use our technology to make these products. But we have to remember that technology and one product cannot give a holistic solution. You have to map that with the social and economic scenario. So the moral of the story is that in every journey there is a decisive moment, or there are collections of decisive moments. But one is triggered from the other. And it is triggered when your passion becomes your profession. If you have a distinct passion and a distinct profession, and profession is something which you don't like, you can get degrees, you can do research, and you can do a whole lot of good things. But it will not drive you to a solution. So this is what I wanted to share, is an experience, my journey, which has never been structured, But at the end, with this some effort, we have got a little success, that it is not just a technology transfer or commercialization of some device or product, but a more holistic intervention to impact the lives of downtrodden people, the grassroots level, and therefore make an attempt to remove the barrier between those who have and those who do not have. And I think that is how dedicated to the service of the nation, which IIT Kharagpur tries to emphasize. That is what, as a professor of the institute, I have been trying to practice. Thank you very much.